Awkward Angels, good morning. So today I'm just gonna give a little life update. I am going to see the neurologist tomorrow. I had to call my primary this morning and get her to send over a referral. I didn't know I needed that, but she was like, "Why do you need to go see them?" And I was like, "Well, because of my face and because of my hand." And she was like, "Well, um, I thought that was from your meds." I'm like, "Yeah, I don't know though." Because remember, my psychiatrist told me not to worry about it, and I don't want it to get worse. So she was like, "Oh, okay." So then she kind of like was more understanding. And then I felt dumb saying this because I feel like people, they don't want to think that I have any problems because they think, "You look so normal. You look like fine. You sound fine." But they don't really know my past or anything that I suffer with. They just kind of see me and think that I have this perfect life. So I got some of my paperwork to show him, so just to kind of have some proof. So I have one. It says, patient is 34-year-old female with significant past psychiatric history of bipolar disorder 1, PTSD, and polysubstance use disorder. Unspecified psychosis not due to a substance or known physiological condition. And then it says that again. And then it says that I have a slowed rate of speech and prolonged latency. Motor function is psychomotor retardation. And it says that my MOCA exam they gave me was a 20 out of 30, which indicate a moderate cognitive deficit. But yeah, I just want to show that so it shows I'm not lying, and I think the substance part is important too, because I have overdosed before. I was on life support actually, because you know why. I can't say on here, and I'm not proud of it, but that happened. I had lithium toxicity. I aspirated when I was unconscious once, and I got pneumonia when I was on life support. So it actually even said in one of those papers that I was at the risk of unaliving myself soon. And if I didn't get my life under control because I was so impulsive. And I didn't want to feel anything, you guys. I was like, I was too scared to cross over, but I didn't want to be alive. And I do want to live now. And I want to have a good life. And I don't want to have to, I don't know, I'm just worried because I can't get a job that I can do. I feel I'd be perfect if somebody would just hire me to clean something alone. That would be a perfect job for me. I've never stolen anything from anyone. I've never done any violent crimes. But they made me sign that dishes paperwork at vocational rehabilitation, and they never called me back to do anything more. They just said, sign this dishwasher paper, and that's just a formality. But now I'm starting to think it wasn't a formality, that they are going to say that they got me a job and I never went to it. But I have PTSD, severe. It could be more than PTSD at this point. I just don't even care to get another diagnosis, but I've been through so much more trauma since that initial trauma that started off this whole crazy thing. And I made a video the other day just kind of talking about some of the things I've been through in psych hospitals, and I'm honestly scared to publish it because you don't even know what they're capable of. Um, especially if they got you when they want you, you could never get out again if you get trapped in there. That's what people don't really realize, I think. Um, but yeah, I'm not gonna get all dark and conspiracy theory because I'm just trying to live my best life. I don't need to be calling anything out right now or putting my own safety in jeopardy by calling out things that I saw, though I want to, and maybe whenever I'm in a better place financially, I'll feel like more safe to speak out about those kind of things. I don't know, it's hard because I don't trust the medical people, but I need their help. I don't know, I don't really believe that I have a cognitive impairment, but maybe in some things like math or like telling time or following directions by myself, that could be kind of hard for me. But as far as reading or writing, I feel like I'm actually able to express myself better through writing. I always have. So I don't think I'm cognitively impaired in writing, but maybe some other things. But I guess we'll see tomorrow. He seems like a nice doctor from his picture. I don't know if that means anything. He I don't know, I never met him before, but he's gonna have a pretty big office, so, hopefully he is nice and hopefully he doesn't. I'm always worried that people are just gonna see me as somebody who's like a liar or she's just an addict. That's the reason why she's like this. Maybe it is, but I don't want to be treated like a dirty addict anymore. Like me and my husband went to IKEA with our daughter, and I don't know. I just struggle to feel like I should be in nice places. Not that IKEA is so fancy or nice, but that's how low I think about myself sometimes. Like people are looking at me at IKEA or something. Look at that trashy woman. No, they're not probably thinking that, but after you've been homeless and been in jail and, done some of the things that I've done, you feel like you don't belong around normal people. So yeah, I'll keep you guys updated though tomorrow. I'm just drinking some tea, some black tea. I'll try to relax and I'll let you guys know what happens tomorrow. Alright, thanks for watching. Bye.